Hi, it's Blair. I'm talking with Leah from Cinnabar Acupuncture Clinic and Spa. And I know you got into this type of medicine because you had your own health issues. Can you tell me a little bit more about how you started?
Well, when I was a teenager, I actually had pituitary adenoma, which is a little tumor in the pituitary gland. And so when I hit puberty, I started having all these different kinds of symptoms. I had a lot of problems with my periods, and they didn't know what was wrong with me. They found out about the adenoma, and the only option was to go in with a laser. And at that time, at least, it wasn't that precise, so there's a good chance that it would damage the actual pituitary gland as well, and I would be on hormones for the rest of my life. So long story short, I was desperate, and my mom took me to an acupuncturist as a last resort. And within 3 months, I had a normal period. My symptoms were alleviated, and my whole paradigm of health and how it related to my body had changed. And from this, my mom started also seeing an acupuncturist for her migraines, and it just really changed both of our lives. And I was going away to school, and I was pre-med. I just realized that I couldn't do that anymore. That I had changed too much my perception of health to go into medicine in that way. And so when I finished college, my mom and I both we moved out here to California and went to school here for acupuncture, which was another 4.5 years. And right now we're actually doing our doctorate in acupuncture now that they opened that up, another 2.5 years up that.
So was your mom a regular doctor before?
No, well, she was supposed to be, actually, because my grandfather and my uncle are both MDs. My grandfather was a general practitioner, and my uncle is an oncologist. And my grandfather really groomed my mom to be a doctor. He was convinced she was going to be a doctor. So since she was a little girl, he would take her along wherever he could to experience the hospital and what he did. And but my mom really rebelled, and she went into business and did something completely different. But she always had that knack for taking care of people, and she always, I think because she was around my grandfather, she always had a lot of insight about what was wrong with people. And so it was interesting that she kind of came back to that later on in life. And I think that was always her calling, even though she didn't recognize it.
Wow. And so can you tell me a little bit kind of about what you do exactly when you perform a treatment?
Well, it varies a lot. With acupuncture, that's kind of a misnomer when we're called acupuncturists, because what we really do in California especially is practice Chinese medicine, and that entails a lot of different modalities. And really, like my teacher at the school that I went to, a Taoist school, and he would always say that you are the medicine. And you're not dependent on a needle or any particular prop. It's like you are the medicine for your patients. So even the way that you talk to them, the way you touch them, all of that is part of the medicine. And when someone comes in, we do an in-depth consultation, and that includes listening to their symptoms, feeling their pulse, and looking at their tongue. And also kind of getting a feeling for their energy. We feel, their back, their spine, and kind of get a feeling for what's wrong with them. And depending on the person, we usually will needle them, and then we may do cupping. Oh, sorry, go ahead.
No.
We may do cupping. We may do moxibustion. We can do massage. We may apply herbs topically on the skin. We give herbs at the end of the treatment for them to use at home, to take it home. But it varies based on the patient and based on how they are doing that day.
Wow. And what percentage of your patients experience success with their treatments?
Well, the vast majority of people, very rarely do we get someone who doesn't feel better on some level. Even if someone has a very severe illness, they're going to sleep better, they're going to feel better, their mood's going to be elevated, they'll have less pain. You can't always fix people because, sometimes things are too far gone. If someone comes in with cancer or a really severe illness with AIDS or something, I mean, I'm not going to cure them, but
Yeah.
I can make them feel better, and on an emotional and physical level. And so I think that it's very rare that someone doesn't feel better after a treatment. It's like saying someone doesn't feel better after a massage, or, you know, once you do something that's going to help strengthen their body, it's always going to have a positive effect.
Sounds like a positive experience. And I know sometimes with acupuncture, especially, people can kind of see it as like, oh my God, needles. Obviously it doesn't hurt anyone because people come back, but is there a specific way that you do it so people don't feel it, or is it just that they're so thin that it kind of doesn't feel like a shot or something like that?
It depends. You actually can have, usually there's different styles of acupuncture. I should start with that. Just like there's different styles of massage, all the way from, very light massage to very deep tissue and ralphing. There's the same type of thing with acupuncture. Japanese style, for example, is more energetic, very, very thin needles, very light needling, whereas the traditional Chinese way is more slightly thicker needles and much more stimulation. Now, there are some styles of acupuncture where you do feel the needling more, pretty intensely actually, but it's not the needle that you feel. It's when the needle is in. If you manipulate the needle more and really activate that point, you can feel what we call a chi sensation, which can be like a heaviness, sometimes almost like an electric shock. And my mom is actually needle phobic. She's very sensitive to needles. So I think because of her, both of us have a much lighter needling style. And you rarely feel the needle going in. If you do, it might be like a slight little prick because the needles are so thin. And we do not manipulate the needles heavily because I don't think that that's necessary, personally. But different acupuncturists do have different styles, so there is going to be a slightly different experience with different acupuncturists. But it's not going to hurt in the sense of like a needle pain like you would get from getting a shot, getting blood.
And what kind of ailments do you treat?
We can treat pretty much anything in the sense that what we do is stimulate the body to heal itself. So, I mean, we can help pretty much anybody. We specifically at our clinic, we focus on obviously chronic pain. That's always going to be mainstay for acupuncture. We also do a lot with mental and emotional issues, women's hormonal imbalances, infertility, PMS, that kind of thing, and also cosmetic acupuncture. We do a lot for your acne, easing, all kinds of things.
Oh, wow. I didn't know it could be used for all that, even like mental issues.
Oh, absolutely. That's actually, a lot of times people come in first for pain because that's what they know it's good for. And, they'll be depressed or they'll have other issues going on, and, those things will get resolved as well, and they're really amazed that it works on that level as well. But yes, that's one of the things that's different about acupuncture is that we look at the whole person. So there's a connection between your physical body and your emotions. And if you are depressed, it's going to affect you physically. And if you are physically hurt and you're not moving, it's going to affect you emotionally as well. It's all one thing.